Hello and welcome, everyone. I'm Kristen Schwartz, MC and a licensed midwife here at Gold. And here at Gold, we are getting ready for our first tongue tie conference 2024. Yes, we had our symposiums in the past and they were so successful and people were asking for more. So this year we have a brand new tongue tie conference. And with me is one of our speakers, Sarah Oakley. Welcome, Sarah.
Thank you, Kristen.
It's good to have you back here at Gold. Lovely to have you being part of the first tongue tie conference here at Gold. And your title is Functional Assessment and Differential Diagnosis of Tongue Tie. We'll hop into that in just one question. I want to ask you a little bit first about your background. You're a registered nurse, a health visitor, an international board certified lactation consultant, and you work in tongue tie. So give us a little overview when tongue tie, you're a tongue tie practitioner, became when did you get into that topic? When did you see, oh, in my field, I really want to get into this and make that part of my work?
That happened around about 2009. I used to work in the NHS in the UK as a health visitor, and I left that role to pursue my lactation consultant work because I wasn't really able to use my lactation skills in my health visiting role. So I set up my own private practice. And in the first 2 years, I was just offering lactation consultancy, and I found that a lot of the parents coming to me were really struggling with tongue tie issues, and we had very few NHS services around us and even fewer private services. And so if your baby had a tongue tie, it was a really difficult journey. It was very hard to get a division, and if you did manage to do that, there was often a wait of 6, 8, 12 weeks, which really didn't make breastfeeding viable. So I started to think this was something that I really needed to do and started to look around for training opportunities. And I had colleagues who were working in breastfeeding support groups and things who were asking me about it and saying, can't you get trained to do it? Because I'm a nurse, that, opens that door for me. So I approached Carolyn Westcott at Southampton, and she put me on the waiting list and trained me in 2011 to do tongue tie division.
Wonderful. So you're actually doing the divisions in your office.
Yes. Yeah.
Wonderful. Wonderful. Thank you for clarifying that. And you even wrote a book about this. So tell me briefly about your book.
Yeah, the book I wrote, a couple of years ago now, it was published. I was really lucky. Pinter and Martin, the publisher, actually approached me and said, would I like to write a book? Because it's part of their Why It Matters series, and they wanted to do one on tongue tie. And I had to do a sample chapter for them and a sort of outline plan, and they accepted what I'd written. And it was actually a really easy process. It probably took me the best part of a year to write it, but I wrote it during kind of 2020, 21, when we were kind of restricted with lockdowns and things. So that gave me the chance to sort of knuckle down and get on with it. But it was originally aimed at parents, but I heavily referenced it, and actually it kind of is open to anyone to read. So practitioners and professionals get an awful lot out of reading it as well, so I'm told, because it is all very, much driven by the evidence base. And I wanted a book that was very UK centric, because a lot of what's written about tongue tie comes from other countries, predominantly America and Australia. And some of the ideas and some of the practices are very different between the countries. So I wanted something that was a UK resource for UK families to read that would be relevant to their situation.
Fantastic. And thank you so much. You have donated some of these books to us here at Gold, so we can raffle them off to some of our winners here later in the conference. So that's fantastic. So let's talk about your topic. Your topic is titled Functional Assessment and Differential Diagnosis of Tongue Tie. Absolutely love that approach because there are factors that can mimic tongue tie symptoms, right? And it is not always easy to distinguish them. So talk a little bit about that, if you don't mind.
Yeah, I mean, I think when you're assessing for tongue tie, it's really important that you approach it, from a lactation consultant point of view. You're looking at the entire picture, the medical history of the mom, the birth history, basic things like positioning and attachment. You've got to kind of look at the whole picture, look at other structural issues, the oral anatomy, how's that impacting this dyad? you've really got to take a very holistic approach, because it isn't all about the lingual frenulum. And sometimes, there is a tight lingual frenulum that's causing a problem, and the baby will benefit from division, but that's not the whole picture. Sometimes
Mm,
actually the baby can appear not to be using their tongues correctly or well enough to feed, but actually that restriction in tongue function is coming from somewhere else, like neck strain from birth or something like that. So you've got to be very open-minded and kind of cover all bases, really, and not just home in on the frenulum and does that look tight, oh we'll do a division then,
mm,
because you're not going to get very good outcomes unless you kind of
right.
consider all the factors that might be impacting.
You mentioned sometimes it is, appropriate to recommend against division. In what, just briefly talk about in what situations have you seen this? Maybe it's something else going on with the baby. What have you seen?
In terms of recommending against division, one of the things that we come across fairly regularly in practice in the UK are babies presenting with things like laryngomalacia, low tone, those kinds of things,
Hmm.
babies with Down syndrome, that kind of thing. And obviously in those cases, sometimes we have to think about, is a division going to be a good idea, or is it going to cause an airway issue? So we have to, obviously seek further advice from our medical colleagues around that and about whether we go ahead or not. And I've had, in some cases, my medical colleagues have been very happy for me to go ahead, and in some cases they haven't. And, there can be lots of reasons why you might hold off. If the baby's
Hmm.
holding a lot of tension in their neck and in their jaw, it might well be worth referring them to a body work first to release some of that tension, because that might lead to improved feeding, improved tongue function in itself, which may then avoid a division. But if you are going to then go do a division, you're likely to get a better result if you've addressed the other associated tensions that go alongside that.
Absolutely. Well, thank you for clarifying that. Yeah, there's a lot going on. It is really to really get a holistic picture, an overview of the baby's feeding overall and baby's well-being, because the baby's not just a mouth and a tongue, right? There's so much
No,
else going on, as you
exactly.
mentioned with what happened during birth, where there, did the baby come down a little asynclitic? What else is there? Tension, torticollis, what else is going on? And also what is mom's anatomy as well, and what is she struggling with? So that makes a lot of sense, really looking at the overall picture, and also probably have a good team to refer to, or have like, it's almost a team approach, correct?
Definitely, definitely. And I think, anyone working in this field needs to work with other disciplines, and have connections with other disciplines. So I work an awful lot with body workers, with osteopaths and chiropractors. I actually do a joint clinic where I have an osteopath come into my clinic and we see babies together, but I
Nice.
refer out to them quite a lot. I've got a speech and language therapy colleague that I can refer babies to. And yeah, I often end up, liaising with paediatricians and other people like that and referring out. And in the UK, we have to go via GPs quite often to get referrals to other
Hmm.
doctors, I think,
Yeah.
which can be a little bit torturous at times. But usually the GPs are very open. If you suggest a referral to an ENT or something, they're very open to that idea. So yeah, so you have to have, know lots of people really, and have lots of relationships and connections to give these
Hmm.
babies the best support.
Let me ask you another question here. What can we do as healthcare providers to better educate the parents? Because what I'm thinking is parents get a lot of information on the internet through social media. Tongue tie is a hot topic. If breastfeeding doesn't go well, the first thing often they see is, oh, that must be a tongue tie, maybe on one of those mommy forums and such, right? And how, as healthcare providers, can we better educate of what's going on, maybe about the functional implications, and also that just having a division is not the solve all, right? There's other things involved afterwards. So talk to me a little bit about that.
That's a really hard question, actually. Because with the best one in the world, we could talk to them about the fact that a lingual frenulum is normal anatomy, and there are other structures involved, and there are other factors involved. But there will be, I find some families are very open to the idea that, I'm suggesting other things before doing a division, or I'm suggesting other things as an alternative to a division. But that it's still very much sold in certain quarters as the instant fix. And when you say, actually, I don't think division is the answer here, you can see,
Hmm.
they look very crestfallen. And also when you say, well, I'm offering you a division, but I can't guarantee it's going to fix, everything that you've presented with here. or, you know, there's going to need to be some work done on things like positioning, attachment, milk supply, that kind of thing. You know, some parents do find that really hard because it is still, you know, as you say on social media, it is still sold a little bit as a, you know, get this division done and that's going to solve your problems, and your baby will sleep 10 hours at night and feed perfectly and never cry again. And there can be a little bit of that going on sometimes. And so, and I do find increasingly we're seeing parents that are presenting with behaviors in their babies that are actually quite normal infant behaviors, but they're seeking a, you know, a surgical solution to what can be a very normal behavior. And I think just reinforcing the normal and reinforcing the idea that a lingual frenum is a normal structure, you know, it is normal anatomy. We are meant to have one. And just the mere presence of a lingual frenum doesn't mean to say we've got to start getting scissors and lasers out to treat it.
To do that. Yes. Thank you so much. Sarah, before I let you go here, any final wise words to our viewers, maybe what you hope them gaining from your presentation?
I hope it just opens people's minds up a little bit, really, to the whole idea that, you know, we do have to look at these babies holistically, and we do need to work as a team. And, you know, tongue-tied practitioners shouldn't be working in isolation, because we do need the skills of others to provide the best care for these babies, and to sometimes unpick exactly what is going on with these babies, because some babies come in and you know, they present with a collection of symptoms and you can't quite put all the pieces of the puzzle together, and you need another set of eyes from a different perspective to come in on that and sort of make other suggestions. So yeah, that's what I hope people get from this, really.
Well, Sarah Oakley, thank you so much for being here with me today. It has been such a pleasure hosting you, and we are looking so much forward here at Gold to your presentation for the Tongue Tie Conference of 2024.
Thank you.
And for our viewers now, some information. If you got curious about this presentation here and all the other presentations of the Gold Tongue Tie Conference of 2024, we would like to invite you to go to goldtonguetie.com to find out more about all the presentations. And we also have some great add-on packages and our free keynote presentations that are there as well that you can check out and reserve your seat. Thank you everyone for watching, and I hope to see everyone at the conference. Bye-bye.